I'm going to be honest with you about something. I have a bias about our next speaker. The reason I have a bias is that, as most of you know, that I'm married to Dr. Ross Nash, and he's still practicing dentistry as well as having the Teaching Institute. And we hired Debi Carr to come in to be our compliance consultant. And while she was there, we were under cyber attack. It was pretty compelling to say, well, this justifies why you are here. We were doing so many things wrong in our practice. I thought letting my hygienist download and print her Bible study for the night was okay, and apparently it's not. Jesus, take the wheel. At any rate, you would think that this topic my team would have groaned and moaned about the fact that they're going to have to spend a few hours with Debi Carr listening to security and HIPAA compliance. You know, at the end of her morning with us, my team said we could have listened to her all day. And I'm sure you will feel the same way after you spend 8 minutes with her. Her topic is timely. Let me do it justice. What's in your triangle protecting your information? Ms. Debi Carr.
How do I go off with that? I'm confident that everyone in this room has some version of this rectangle. I can check the weather. I can get directions. I can pay bills. I can even make a phone call. Wouldn't Alexander Graham Bell be amazed at the progress of his invention? Have you ever lost your cell phone? Have you ever felt that panic that sets in? That anxiety attack? Is this because you are never going to speak to another live person? No. It's because our cell phones are actually mini computers, and as such, they have information, data, that we want to keep confidential. In cybersecurity, every decision we make falls in what we call the CIA triangle. What information do we want to keep confidential, maintain its integrity, and be available when we need it? We start by identifying what information we need to put in our triangle. For some, it could be our social security number. I certainly want to keep my social security number confidential. I definitely want to maintain its integrity. I don't want to wind up like Jay Leno, where somebody's getting his benefits or my benefits before I get a chance to, especially as I get a little closer to that one. And I want it to be available when I need it. For some, it could be financial records. During COVID, one of the services that we provide is to help doctors when they have been hit with ransomware. I had their patient data because they were backing up their patient data. They were not backing up their financial data. And as a result, that was compromised and I couldn't do anything. Patient data. I've had a lot of dentists tell me, I'm just a dentist who wants my information. The reality is that when a threat actor, and that's what we call a hacker, when he knows that he's in a dental office, he knows that he's hit the crown jewel. We have their demographic information. We have their oral benefit information. I hate the word insurance. We have their oral health history. Oh, but wait. Now we have certain procedures that we have to file to medical, so now we have their medical insurance, and we always have their medical history because you need to know, are they on a bisphosphonate or are they on a blood thinner before you extract that tooth? My husband and I have decided to put our home inside of our triangle. We've identified that there's information, assets within our home that we want to protect. I live in Christmas, Florida. There was a time when we didn't lock our doors. Now, we lock our doors, we have a deadbolt, we have a sign that says alarm company. We have an alarm company. We have perimeter cameras and the Ring doorbell. Ding dong. The Ring doorbell detects abnormal activity at my front door. It alerts me when there is information or something happening out here that I need to respond to determine, is this an event that could adversely affect my home? I mentioned we live in Christmas. My husband thinks Amazon is Christmas every day. But it allows me to respond to determine, is this a package being delivered? Is this a friend that I want to grant access to my home? Or is it an adverse activity or event that could impact? Because we all want to resume our normal lives, right? We want to recover quickly. I'm the type of person that if you give me a checklist, I can make it happen. Our government has given us 2 checklists. The first we find in the Health Insurance Portability and Accountability Act. Oh yes, HIPAA. If you look at HIPAA in the right format, the privacy rule is what is in our triangle. The security rule are the protections that we use, the mechanisms that we use to protect that information. See, they didn't reinvent the wheel. They knew that they were using best practices, and when implemented correctly, it is best cybersecurity practices. In fact, 164306 of HIPAA security rule says that a covered entity will protect the confidentiality, the integrity, and the availability of patient information. They didn't reinvent the wheel. The second one that I use with my clients is called the cybersecurity framework. And I was literally jumping for joy on January 5th this year when President Trump signed in the amendment to HIPAA, which is a safe harbor law. It creates a safe harbor if you can demonstrate or document that you've had a recognized cybersecurity framework in your practice for the past 12 months when, not if, when there is an attack. We have seen a lot of attacks over the last few weeks. I got news for you. Those are just the ones making the news. Dentist offices are getting hit every single day. 2 days ago, the White House sent out an alert, the White House and FBI sent out an alert to warning healthcare entities, especially the small healthcare entities, that they are prime targets. These attacks are not going to go away. And the only way to protect a practice, to protect ourselves, is to have a security plan in place. So the cybersecurity framework, identify what information you want to put in your triangle, identify what potential risks there are to those assets or that information. You want to protect, you detect by making sure that the protections are in place, you respond, you recover, you repeat. See, compliance will never bring security, but security will bring compliance. So I ask you, what's in your triangle? Thank you.